In my capacity as Chair of the Culture, Arts and Leisure Committee, I'm delighted to welcome you all to today's seminar. The theme of the session is social isolation and inclusion. And the two papers that you're going to hear examine firstly the issue of isolation among older men, and secondly, the accessibility of our arts venues for the visually and hearing impaired. The programme for government stresses that the executive is committed to a range of measures to tackle poverty and social exclusion through the Delivering Social Change framework. It goes on to state that this will include actions to ensure compliance with the United Nations Convention on the Rights of People with Disabilities. And it also refers to supporting research to tackle multi-generational poverty and social exclusion. The Culture, Arts and Leisure Committee is currently conducting an inquiry into the accessibility of the arts. And we've heard evidence from some of our major arts venues. We've had the Lyric Theatre, the MAC, National Museums and the Crescent Arts Centre. The Arts Council, whose work we scrutinise, also has an arts and older people strategy. And that strategy refers to some of the barriers faced by older people in accessing the arts, including poor health, poverty and transport issues. As a committee, we've been monitoring the progress of a review of sign language provision being conducted by the Department for Culture, Arts and Leisure. OFM-DFM Committee also has a role to play here. It's been scrutinising the Delivering Social Change framework, as well as the draft Active Ageing Strategy for Northern Ireland. OFM-DFM is also responsible for a policy called Lifetime Opportunities, the government's anti-poverty and social inclusion strategy for Northern Ireland. It's always good to have succinct titles. That's a strategy which is important, but it comes to an end next year. Ensuring that both older people and those with a disability are socially and culturally involved in society is an issue that extends further across the executive, however, than just DCAL and OFM-DFM alone. This is a much, much wider issue. And of relevance here, then, are the Tackling Rural Poverty and Social Isolation, or as it's known by us here, TRPSI programme, overseen by the Department of Agriculture and Rural Development. Transport issues is overseen by the Department for Regional Development and the Department of Health's own Transforming Your Care review. So you can see that there are impacts and influences there in a number of different departments. It's also important to note that departments are seeking to tackle social isolation within the context, the very current context, of intense budgetary pressures. So the two papers that you're going to hear this afternoon are both from folk from Queen's University Belfast and Frank Johnson from Volunteer Now. And these highlight two different social inclusion challenges. First of all, we'll hear from Dr. Paula Devine and her colleagues, and they're going to ask if we're meeting the specific needs of older men in tackling social isolation, loneliness, and depression. I was depressed the other week when I visited one of those men's sheds, which are for older men, and the first person I met coming out the door was someone who was in my class at school. That was not a good start to that day. But we're glad to have Paula with us. She's going to look at the specific needs of older men in those different areas and examine whether men have less involvement in support and friendship networks than women do. We'll also hear from Dr. Sarah Erdley-Weaver, who has been examining how accessibility can be improved for people with varying visual and hearing ability issues, particularly within settings such as theatres, cinemas and museums. So there are two interesting papers that you're going to hear this afternoon, and with those particular thoughts in mind, it is a great pleasure that I introduce our first speaker today, Dr. Paula Devine.
Okay, so good afternoon, everybody, and thank you very much to the Assembly for giving us the opportunity to talk about our research today. And today, myself and Frank are going to talk about a research project that was undertaken last year looking at social isolation and older men and whether services are meeting the need. I'm going to talk about the research, and then Frank, as Commissioner of the Research, is going to, at the end of the presentation, talk about the next steps and where the research will be leading to. So, Northern Ireland is ageing. We've all heard these talks of demographic time bombs and how population across the world, not just in Northern Ireland, is ageing. And what exactly does that mean? Well, to think about it in numbers terms, from the 20 years from 2013, it means that the number of people aged 65 or over in Northern Ireland is going to grow by 63%. That's compared to 9% for the whole population. So you can see that our population is changing. And it also means that actually there's going to be an increase in the number of older men in our population. So they're going to be more visible demographically. And as we've just heard, there's been a growing policy interest in the needs of older people over the last decade. So we've heard quite a long list of policies. Again, we've just heard a lot of them: the Ageing Inclusive Society, Lifetime Opportunities, Transforming Your Care, Active Ageing. And appropriately for looking at a project on older men, there's also the relevance of the Gender Equality Strategy and what its replacement going to be soon. So I'm glad I've got all the policy names out of the way. As you say, as we've heard, they don't automatically trip off the tongue. So, much research has told us that loneliness and social isolation are major issues in our society, and they're particularly relevant for older people. Their loneliness and social isolation can cause depression, other mental health problems, and also contribute to negative impacts on physical health. But loneliness and social isolation are terms that are often used interchangeably as if they're the same thing. So I just want to start off by highlighting definitions of the two. So loneliness can be seen as a subjective measure of unwelcome feelings or perceptions associated with a lack of contact with others. So it's how the lonely person feels, that they feel negatively about this. Whereas social isolation can be seen as a more subjective concept, and in fact can be seen as a continuum ranging from an absence of contact at one side, which is social isolation, ranging to high levels of social contact and participation at the other. Given those two definitions, it is possible to be socially isolated but not lonely, because you're happy not engaging with other people, and therefore you don't have those negative feelings about it. But older people are particularly vulnerable to both loneliness and social isolation due to a loss of friends, a loss of family, a reduction in income, and a reduction perhaps of mobility. So in 2014, with funding from the Public Health Agency, the Men's Working Group were concerned about services for older men in society. And they commissioned researchers from the School of Sociology, Social Policy and Social Work at Queen's University to undertake a review of services for men aged 50 or over living within Belfast. Within the project, we defined Belfast as being within the Belfast Trust area. So it is very much looking at an urban area, and the issues concerned within an urban area are perhaps different to that in a rural area, although there will be some overlap. So we had two aims of the study. First of all, to review the extent and impact of current services to combat social isolation within Belfast for men within this 50 and over age group. And these were men who were retired or not working perhaps due to ill health or redundancy. And also men who were tending towards social isolation. And we also then wanted to look to see how are the services that are provided for this particular group are meeting the need. And also how could these be developed in the future to meet the needs of future requirements. So, our methodology. The project took place between January and May 2014. So it was actually a very, very quick turnaround and a very quick time span. We had 4 stages. The first of these was a review. An audit of current services with a specific focus on socially isolated older men aged 50 or over. And then we undertook 10 in-depth interviews with older men aged 50 or over. This was an important part of the project because this provided the expert knowledge. But the caveat is that all these men were members of existing groups. This was mainly for pragmatic reasons and also ethical reasons. So we are aware that obviously these weren't men who weren't members of groups and weren't perhaps then maybe the most socially isolated. But what we asked this particular group of men was to think about why they became connected with a particular group. What were the factors that helped them do this? Were there any barriers that they thought were an issue for themselves or for other men in the future? And also ways that they think services could be developed. We also undertook 6 interviews with stakeholders, and these were either people who were involved in the strategy, policy or funding of groups for older men. And we also want to acknowledge a group of peer researchers of older men who helped us with the development of our questions within the interviews and also looked over our final report as well. So, in our literature review, I managed to say it, we looked at a series of different interventions, both locally, nationally and across the world, that have been used to address social isolation with older men. In summary, we found that group work schemes seemed to be particularly effective, whilst one-to-one interventions were least effective in this context. That's not to say that one-to-one interventions such as befriending schemes don't have an important role to play, but in terms of the group that we were looking at, we found that group work schemes appeared to be the most effective. But there are also a lot of structural issues, and again, Mr. McCausland referred to these earlier, such as transport and poverty, which are particularly significant factors associated with the social isolation of older men. We undertook an audit of existing services, and again I have to stress that this was very time-bound. So this took place in April of 2014. If you undertook the same audit now, I think it would be completely different for lots of different reasons that we're going to talk about later. So using a series of web searches, phone calls, looking at different literature, one-to-one contact, we were able to identify 125 services across Belfast that were for men and women of any age, and we found that libraries were particularly important in providing that focus. There were 20 activities that actively target men of any age, but there were 12 specific services that focused on men aged 50 or over who were socially isolated, and that is the men's shed that we've just heard about, and we were able to identify 4 within Belfast. There was a wide range of services, one-to-one befriending schemes to men's sheds. Some were open to all, some were for specific groups, for example, people with dementia. We found that there had been quite an increased development in that churches were often keeping groups open, maybe perhaps through this period of austerity. But as I do stress, this is a limited snapshot in time. We found that there was a wide range of services, a very diverse and very comprehensive range, and generally they met men's self-reported needs. But there were 2 key messages that we want to bring out of this audit. The first of those is that of funding and sustainability. The cuts within the voluntary and community sector, I think, are very wide-ranging and very widely publicised. But in particular, the end of significant funding programmes such as the Big Lottery Reaching Out Connecting Older People programme is or has had a really serious effect on a lot of the groups that we were talking about. We also found there was variety in the capacity and desire for particular types of services. So there's high demand for befriending services, but not for others. So turning now to the interviews of the 10 men, we asked them about the pathways or the reasons that they got involved. And these varied quite a bit. Some men mentioned that they were demoralised after unemployment or retirement, and they stressed that work was very important to them in terms of their identity and in terms of their self-esteem. So when work finished for them, they were found that they were looking for something else to take that place. And some men mentioned that they felt that home was actually the domain of the women in their lives. So when they were at home all the time, they felt they were maybe getting under the women's feet, so to speak. So they were looking for some other kind of activity. And also the impact of ill health was mentioned by several men. Could be mental ill health, it could be addictions, it could be physical health. Several men talked about having cancer, and this was a rationale or a reason for them wanting to find something else. Many mentioned a type of epiphany after a health scare and felt they wanted to give something back to their society. We also asked our interviewees, were there any barriers to taking part in any activities or services or organisations? And masculinity and pride came up several times. For example, many admitted there was some kind of stigma in admitting that they were lonely or going through a difficult period in their life. And they found it quite difficult maybe to talk about this in a mixed sex setting. Some said that there was fear of attending a group and then finding they weren't able to do the activity that they'd signed up for, so they were quite anxious about that. And there also was limited engagement with very isolated men. Word of mouth was seen as very important about making contact. So obviously, if word of mouth is the vehicle of getting access to potential recruits, then that is missing out those men who are very socially isolated. And we also need to mention the legacy of the conflict. This wasn't central to our project at all, but it was brought up by several men in different ways. And there was a strong link between conflict, masculinity, and identity. And for some men, the legacy of the conflict and current events are central in their lives. At the time that we were undertaking the project, things like flags dispute, parades disputes were very central in the life of some men. And they found that services or organisations or places where they go to meet older men can sometimes be a place of tension if these issues are brought up, or sometimes they can actually be a place of potential reconciliation. Some men welcomed the opportunity to talk about these issues openly, whereas other men welcomed that places were perhaps neutral, where discussion about these issues wasn't encouraged. There was also the specific needs of ex-prisoners was highlighted, for example, mental health, addiction, and dealing with the past, which includes life in prison and also their life post-release. So in summary, our stakeholders talked about their lives being transformed by involvement within these particular groups. Accessing services played a pivotal role in their lives, and especially in their mental and physical well-being. And they talked about the improvements made because of things such as improved social contact, friendship, having a sense of purpose in a post-work context, improvements to their mental and physical health, and feelings of usefulness. And other men mentioned that membership of clubs sustained them in behaviours which helped control several different types of addictions. So the third stage of the fourth stage of the project was talking to stakeholders, and these were people who were involved in the commissioning or the direct funding of these services for older men. And we asked them about the strategic and funding context. None of them said they had a strategic focus to focus on older men, but they will fund such projects or services if the need is explicitly identified and highlighted on a grant application. They did state that men's groups were underrepresented as applicants and therefore as grantees of funding programmes. And perhaps this is because limited experience and capacity in relation to funding and governance hinders sustainability and the ability of groups to apply for funding. Also, these interviews highlighted the lack of knowledge of services across sectors. This is everything from healthcare down to the voluntary and community sector. So this inhibits collaboration across sectors. It in some ways can help promote duplication, but it also inhibits the uptake of services by potential users. So at the end of the research project, we drew together all the information that we collected across these various means of data collection and came up with 12 suggestions for activities or issues that should be taken into account by groups that are thinking of or are currently providing services to older men. And we're not saying that all of these issues aren't already being undertaken by men, but we just wanted to highlight them. So the first one was to increase the capacity of voluntary community organisations in relation to funding and governance issues. For example, one recent development is the need to register with the Northern Ireland Charity Commission. So some groups are unable to do this or don't know how to do it. So it's about trying to increase groups' capacity to do this and also to take up the help and advice that is available from a range of different services, such as the Charity Commission or NICVA, other organisations like that. Also should encourage organisations to take part in government consultations, such as that for the active ageing or the gender equality strategy. useful to join relevant networks. That could be things like Age Sector Platform, which is relevant for older people, things like the Men's Health Forum in Ireland, looking at men's health in particular, or NICFA, which is looking at the voluntary and community sector. And it is important to develop a clear and up-to-date directory of services for statutory and third sectors so that people know what's out there and how they can help signpost people to take opportunities. And linked into that is the need to involve and train health and social care professionals so that they can recognise loneliness and isolation among their service users and patients and hopefully signpost them to appropriate services. And there's also a need to evaluate what works so other people can learn those lessons as well. Other suggestions relate more to policy and practice. So it's thinking about how to engage with older men as men. So it's thinking about gender and masculinity and how that can affect people's practice as well. And there's a few guides out there that can help people do that. It's also important to acknowledge diversity. Older men are not one homogenous group. They vary in their talents, their abilities, their interests, their ages, but they also need to think that Northern Ireland is also very diverse in terms of lots of different things as well, in terms of ethnic groups, in terms of sexual orientation, in terms of where people live, their family circumstances. So we need to acknowledge that diversity in the population, and that may also affect then the range and types of opportunities and activities that are offered. It's also interesting that some men brought up the idea that perhaps men-only services are not always the most appropriate. Some men enjoyed working in a men's shed and a men-only environment, whilst others said that they would have preferred or enjoyed working or participating in services and groups where it was a mixture of men and women. And kind of leading on to that is also our groups that are made up of older people, the most appropriate for as well. So there is the need to think of intergenerational work. And today is the EU Day of Solidarity between generations, so perhaps it's a very pertinent issue to raise as well. And again, it's also important that people recognise the legacy of the conflict. So the full report is available online and was published in 2014. So now I'd just like to hand over to Frank to talk about the next steps. Thank
you. Thanks, Paula. What I'm going to do is give you a little bit of background to the men's working group, which I think would set the recommendations in context in terms of the action plan. I've been working with older people for over 11 years now, through Volunteer Now and through the legacy volunteer centres that became Volunteer Now. And a large part of my work in the early days was working with older persons groups and forums throughout the community. And what was very noticeable from the start was the absence of men, older men. They just didn't take part. And that led us in 2008 to bring older men together in Belfast and to ask them what they wanted to do. And we created a group called Men United. And that group is still going today, 7 years later, and it organises a whole range of health and well-being and social opportunities for older men. But we recognised that we couldn't do that on our own. We needed to develop partnerships. We needed other people who had an interest in engaging older men to come together. So we established the men's working group in 2010, towards the middle of 2010. And members of the group include Volunteer Now, the Men's Health Forum in Ireland, North Belfast Senior Citizens Forum, Engage with Age, East Belfast Community Development Association, and Rejuvenate Men's Sheds with North Belfast Partnership Board. So all of these organisations came together. They recognised that older men weren't necessarily getting the support that they needed. They were all trying to do work with older men in their own particular areas. And we recognised that we really needed to share information, good practice, identify gaps, and also look at how we can actually build that capacity to engage older men. Because older men are out there, let's not forget that, they're not invisible. They don't just disappear after retirement. So each of us in our own small way, we're trying to look at how we could engage and support those older men. So out of that, in 2014, we commissioned Queen's University to look at the gaps, to look at research directly with the older men. And we're delighted with the research report that Queen's produced. And that, again, was only possible through the support of the Public Health Agency, which I should note today. But where do we take that research? So we have the research, but really what the working group was always focused on was, well, where do we take it? How do we actually build that capacity? How do we actually implement and encourage organisations to work together more, and how do we encourage men to actually come together and form groups. So we come up with a number of core recommendations. We've had a number of workshops since the Queen's research was published, and we have consulted with a range of stakeholders. What we wanted to do was focus on practical things that would help, you know, for over the coming months and coming years, build that capacity and hopefully have an immediate impact. As we know at the moment, with all the cuts in the sector, it's a very, very difficult time. But if we're going to do this right, we need to look at doing it right. We really do feel that we need to appoint essentially a project officer, a capacity building worker, to help develop those partnerships across Belfast, not only with the organisations who are currently working with men 50 plus, but also there's organisations that would like to, but just don't really know how to do that, and would like to link in, look at what good practice there is there already. And we need that person to coordinate and drive that and organise that. So we feel that's a core recommendation coming out of that. Paul has already mentioned the Directory of Older Men's Groups. Really, really important. I mean, one of the things that we get obsessed about is putting everything onto the web. Having worked, to say, with older people for quite a long time, a lot of people, while they are starting to get on the web, still like to touch and feel something, you know, real, as it were. So we really do need a Directory of Older Men's Groups, but not just older men's groups, but also where they can go to for support if they want to start a group. Where would they get information on funding, signposting information? So we really do need to pull that all together. We've done had a great start with the research that Paula has undertaken, but we need to develop that, and we need that directory to go into libraries, GPs' practices, sporting associations, you know, pubs, clubs, betting shops. We need it to go everywhere. We need men to pick this thing up and pick up the phone then. And what we're also going to do in conjunction with that is encourage those organisations that are in the directory to have open mornings, open afternoons, to encourage men to walk into their projects, walk into their offices and find out a little bit more, because if the welcome isn't good, they ain't going to stay. So we need that directory. We also need to strengthen those linkages with partners, and there are already some very good existing relationships with organisations through the Men's Working Group, but we need to build on that, not least with funders, not least with the wider statutory sector, including the health and social care sector. And we need those relationships to be strong, because some of the other recommendations underline that. We need everybody focused on this issue and recognising that if we don't engage older men, they are going to present themselves to A&E or to their doctor with an illness they haven't dealt with depression, whatever, and that has a real cost, not only to them and their families, but also the health service, which is a big policy driver at the moment. We also believe you need to get out there and you need to engage older men. So we believe we need to organise an ongoing series of engagement events. And what we want to do is partner up with organisations that older men would like to hear more from. And that could be around sport, GAA, rugby, soccer. And we'd like older men to come to those events, link in with other older men, but also find out through that, have an enjoyable time, but also find out what other men's groups there are in their local area. But also then, we're very keen to encourage them to start their own groups. A lot of older men coming out of work say become invisible, but they have a lifetime of skills. As a volunteering-led organisation, we really feel that men can do so much with those skills in terms of giving something back, but they can start groups. It's all the older persons groups in our community are led by volunteers. There's volunteers who run committees, run senior citizens forums, are out lobbying and campaigning. And men need to catch up with that. I mean, there's a huge explosion in men's sheds, but men want to engage in lots of different ways. So we need those engagement events. We need them to be in a format they're not going to put men off. They're not going to be too wordy, but they will find them enjoyable and hopefully take that next step. We are very keen to encourage men to start their own groups. We really feel that it's not all about giving. It's also about showing men how they can give themselves, how they can start a group, how they can actually determine the future of that group, what it's going to do, link up with other groups. And as Volunteer Now, we're very keen to provide some training around committee skills, how to recruit volunteers, role descriptions, all of that. But there's a real opportunity there to encourage men to do that, to start their own groups and not just provide services for them, because lots of them are quite capable. They just need a little bit of support, a little bit of pointing in the right direction. We also believe for those men who then want to get to the next stage of starting a group, we need to develop and deliver capacity building workshops, getting your constitution together, your bank account, committee skills, recruiting volunteers, all of these things. These are the nuts and bolts of getting a group going, but really, really important in terms of helping them to attract funding. And we need to deliver those capacity building workshops locally in areas where men can access them and on a regular basis. And they also need to hear from other older men in their groups how they did it and what they got out of constituting your group and forming a group. We also believe that we need to have a small seed capital fund. We need groups. One of the biggest cries from older persons groups is getting funding. So we need to have a small fund that those older men's groups can apply to and get some funding to get a venue, to get flyers and posters put up, and maybe then to look at the programs that they want to deliver, maybe buy some equipment if they're in a venue. We also believe very important that those men should come together on a regular basis. So we'd like to establish a Belfast Men's 50+ Forum. Really important that those men, as I say, have the space to talk to each other, make those linkages, and take that in whatever direction they want to take that. We believe that men are at different stages in terms of where they are in terms of tending to social isolation. Some men just need to be given some information. Others actually are really very, very isolated, have completely lost their confidence. And we really, having delivered a whole range of buddy volunteer programs, really believe that there's value in men buddying up with other men, more confident men, more active men, buddying up with those men maybe who really have completely lost their confidence, and helping them to integrate into whatever activity that into the group or an activity in a local community. So we're advocating a pilot volunteer buddy program, and Volunteer Now has done that, or delivered after many years with the Department for Regional Development with our transport buddying program, and helping a whole range of vulnerable client groups to access transport, and it really does work. And when you give people that one-to-one support and you listen to them and you take them through those different stages, it can have a transformational effect in terms of their ability to integrate and get out and about. We also believe really important to develop workshops around good practice. One of the things is the projects here today that are involved with older men's work, they're facing loss of funding in another year or 2 years. I mean, there's no continuity in terms of the funding. We're going to lose some good projects out there in the next year or so, and we need to look at highlighting good practice. We need to look at funders, or get funders involved in agreeing what good practice is, and looking at and encouraging more projects around older men and setting some benchmarks around that. And as Paula said, very, very important that we bring in the statutory sector, the health sector, and we believe it's really important to develop frontline training for health professionals, care staff, district nurses, social work teams, and then basically, show them how you can signpost those men onto services, because often a kind word, often a phone number can make the difference in terms of an older man really, continuing down that road of decline, or perhaps taking up a service that can transform their lives and making new friends. So, we can't underestimate the importance of working with those frontline staff and encouraging them to signpost those men on. But they need to know how to do that. They need to know who to signpost on to. So it's really, really important. Just some concluding thoughts there. Acute loneliness and social isolation are major challenges for many older men, but for older people in general, it's the bane of our age. But older men, as I say, are not as well organised and are not as keen to get involved in what's out there at the moment. Vast majority, as I say, of older persons groups, it's older ladies. The men are not there. So we need to take this work seriously. We need to carry these recommendations through if we're serious about not only engaging older men, but actually turning those men into an asset for local communities, because they have so much to give. It's not about just giving the older men, it's about what the older men can give, and we need to encourage men to give, and they will receive in return. And again, we talked about the impact. If we don't treat this seriously, if we don't implement these recommendations, the impact on health and social care services, we know that with A&E and other services, that if we don't take a preventative approach, we're all going to suffer in the long run. And we do need a sustained, flexible and creative multi-sectoral approach to that. And I really believe that collaborative working is the key to this. If we don't all work together, we're not really going to achieve anything. I just want to really leave you with one example, and we have a Rejuvenate Men's Sheds project here today, but a gentleman that would have come to some of the forums and the groups that we ran and still run, Tom from the Shankill in his 80s. Tom basically was a very good dance instructor, and as I say, he lost his wife in the last year or two, and a huge point at which he could have really gone downhill, and it could have been very negative, but Tom got involved in Rejuvenate the Men's Shed in North Belfast. He was involved in some of our forums, and it's absolutely transformed him. Tom at the moment is badgering us to deliver ballroom dancing classes in North Belfast. Absolutely wonderful example of how that intervention in terms of giving people the confidence to express their skills, to get involved, to say in men's sheds, and giving something back. And Tom's one of those success stories, but we can have lots more success stories if we take this work seriously and we follow through in these recommendations. So thank you very much. Really appreciate that. Thank you.